My name is Anthony J. Berni. I'm with St. Charles Orthopaedic Surgery. Today I'd like to talk about knee replacements on the younger patient. The traditional way to fix knee replacements is to use bone cement. And one of the downsides to that is the bone cement can loosen over time, particularly if your activities have been very demanding or involved any sort of impact. The way that I have been doing knee replacements exclusively for over 15 years is in a non-cemented fashion, where we do not fix the components to the bones with cement. In the case of the lower component, these are fixed down to the bone with screws. And here you see a component that's cemented, where it has a very smooth surface where it gets cemented to the tibia, whereas we would use one with holes and a very porous looking material that would be screwed down to the bone, and that would actually allow the bone to heal into the metal. So that metal bone interface, which is there, becomes a healed single unit, like you would heal a fracture. So this component actually becomes part of you. Therefore, it does not tend to loosen over time. Additionally, on the femoral side, we would use one with a very porous ingrowth surface where your body would grow into that prosthesis. Additionally, the plastics that are used have been materially engineered over time to give much greater duration of durability, so they don't wear out as quickly. So we're thinking now that they are going to last people the rest of their life.